Welcome, friends, to this episode of the Sync Your Life podcast. Today, I am joined by my friend, Michelle Jorgensen. She's in her home out of Utah, and I know that we're going to be diving deep into the subject of functional dentistry, which is a new topic for me. This is something that my family has just started to seek out here recently, but I'm excited to learn from her. She's got this entire wellness practice, this sort of naturopathic practice that is really intriguing. She's got a powerful story behind what led her to this. And I know you guys who are listening are going to say, wow, this is some information that maybe I've never heard before. So without further ado, Michelle, I'd love for you to introduce yourself. Tell us a little bit about your backstory, what led you to doing what you're doing now, and we'll go from there.
Thank you. I appreciate you having me here. I really always love teaching people. So any opportunity is a great opportunity for me. I'm a dentist and my father is a dentist. I have 3 younger brothers that are dentists. So it's just what our family does. And so I was going along, doing fine, busy family, 4 little kids, busy practice, all those kinds of things. And my health just started to go downhill. And, you talk a lot about all the sources and reasons behind health conditions. And so I started going down all of those roads. My gut was a mess. So I thought, well, everybody's gut is a mess about midlife, or at least, it wasn't midlife, actually, it was mid-30s, but, everybody's gut's a little bit of a mess. So I started looking into that and doing doctor visits. But the 2 big symptoms that were really concerning were memory. I've always had a very good memory and I couldn't remember a patient's name from room to the next. And that was really alarming for me because that was so unusual. That and numbness. I had such bad numbness, I couldn't hold an instrument anymore when I was working. Not only that, but I couldn't brush my teeth. I couldn't put on mascara. I couldn't blow dry my hair. Anything that required me raising my hands, I couldn't even sleep because all night long my hands would be so numb and painful that I couldn't sleep. So I went to doctor after doctor, I got MRIs and tests and physical therapy, and I was the frequent visitor at the chiropractic office and on and on and on. And really the needle wasn't moving. So I actually put my practice for sale. You can't actually do dentistry if you can't hold an instrument. It's kind of hard to do. So I had to put my practice for sale. And in the middle of trying to figure out what I was going to do with the rest of my life, here I am, mid-30s. My husband was also working for the practice. So this was our only income, our livelihood, everything else. Finally, another practitioner, he said, you sound a lot like me. Have you looked into mercury poisoning? And I said, oh, I don't have any amalgam fillings or silver fillings, the words that we use. And he just kind of smiled and he said, it's not the fillings you have. It's the fillings you've been drilling out for the last 12 years without protection. Well, this was the very first time I, as a dentist, had ever heard that this could be a problem, ever. The only talk that we have in dental school about mercury and fillings is that there is some, but it's super inert and it can never cause you harm. And if you tell anybody that it could cause them harm, you will lose your license. So you've now had the entire dental school education about mercury. So I got tested and sure enough, mercury levels off the charts. I had no idea that this could even be a concern. And then I started studying mercury. And what is mercury? It's a neurotoxin. So now my brain fog issues, my numbness issues, and my gut issues, because mercury also interferes with the production with zinc, which interferes with the production of stomach acid. So now the mercury was also making it so my stomach wasn't working. All of the symptoms were lining up. So I started a really slow, laborious detox process. But the doctor said, listen, you can't continue doing what you're doing if you expect to get this out, because if you're putting it in as fast as you're taking it out, then you're never going to get better. So you've got to figure out, if you're going to continue doing your job, you're going to have to figure out how to get it out of your body without getting more in. So I started looking, were there ways to do this? And unbeknownst to me, there's an entire organization that's really dedicated a lot of its professional time towards this exact topic, toward mercury and fillings. And so I learned from them an entire protocol on how to remove these safely. So I started doing it for me, not for my patients, but for me. I needed to get better. And all of a sudden the patients were appreciative. And then they started saying, hey, my doctor's been looking for someone that can do this. Can I send them, can I tell them about you? And so well, of course, tell them about me. So I had to start learning so I could talk to these doctors who were very knowledgeable about this topic, much more so than me. They would bring me books. They would tell me to look up things. I'm thinking, I'm the dentist. This is my profession. You know so much about this, more about this than I do. And then they would start asking me, well, if you do this, do you also do this? And these were all things I had never heard of. So I'd say, well, I don't, but I'm certainly able to go and look and learn. So I had to go all over the country, even out of the country, learning things about connections to dentistry that I didn't expect. that have enormous impacts on overall health. And what's come out of that is an entirely new way of practice. I don't even remember the way I used to practice anymore. But when you come to my practice now, it's all about wellness. It's all about health. It's all about, what are you suffering from? What conditions do you have? And could there be a dental connection here? And if so, let's help you with that. And then we support with other things. So when you use the word functional dentistry, the reason I use that term is because it is. We're looking at the function of the body. We're looking at the way things work and saying, could dentistry have an influence on the functions that are going on in the body as well? And I know that you work a lot with those topics and those things. So I'm excited to be here because I think I'm going to give you some answers to things that perhaps people haven't had answers to before.
Absolutely. Yeah. I'm excited for this because, like I said earlier, this is sort of new to me. I was on a phone call a couple of years ago with a group of my health coaches, and I was telling them, we were talking about my story and my migraine issues and whatnot, because there was another person on the call who was suffering. And one of the women who was on the call said, Jenny, have you ever looked into functional dentistry? And I was like, here I was, probably 12 years into my functional wellness journey with a functional medicine practitioner, but functional dentistry had never been mentioned before. And I feel like, at least where I'm located in the Midwest, there's not a lot of options. I remember asking my functional wellness doctor, is there anyone local that I could see? And she wrote like a name on a piece of paper, it was like, I think this person does it. So I want to hear, obviously maybe it's not as rare as I think, but it's a different approach to dentistry. So you've sort of touched on how it's root cause dentistry and how it's very tied into this concept of getting to the root of what's happening for people, the underlying causes of what could be happening. But aside from that, like how are things different with functional dentistry? I mean, specifically, like, can you tell us more about, are cleanings different? Like, what types of products are used? Can you also talk to us about, when it comes to the fillings, what other approaches are taken? Or, what are those specific differences between the two?
For sure. The typical model in dentistry that everybody knows is you go into the dentist, they lay you back, they clean your teeth, take a few x-rays. Dentist comes in, looks at those x-rays, says, oh, you have a cavity here. Let's get you scheduled for that. You come back in a few weeks, you get the cavity filled, and then you do it all over again in 6 months, right? That's the model. But did anyone ever talk to you about why you have that cavity? Or could you prevent other cavities in the future? Or what material they're going to use to restore that cavity? Could that be problematic for your health? Or what else is going on in your mouth that could also be problematic for your health? So it's really just stepping back. That's how I really view this, is stepping back out of our role. Often dentistry is a very mechanistic profession. We're mechanics. We're tooth mechanics. We fix stuff. We drill holes in stuff and we plug them up. And that's really the role that we've taken, is a mechanic of sorts of the mouth. Well, there's so much more to it than that. So there's a book that was published, I believe it was about 2017, 2018, right in there. And it's called The Hidden Epidemic. And the reason I love this book so much is because it's written by an MD. So it's not a dentist that's talking about this. And this book is written by a man named Tom Levy. And he, in that book, says that 60 to 80% of chronic disease is either caused by or contributed by dental problems. So let's talk about what those are and what they could look like. So let's start clear back at that cleaning appointment. Materials used during that cleaning appointment. Fluoride, a real common one. And I know your world is hormones, and there's an enormous connection to fluoride and hormones that people don't understand. And, it's interesting because there's two topics in dentistry in particular that have had a lot of political outrage. It gets people so mad. I don't like to get into the outrage. I just like to get into the science and what's actually real. So fluoride is one of those that have set off just a firestorm of people that are so angry about it. Well, I've just looked at what does it actually do in the body? So fluoride is a compound that does incorporate into the tooth itself. So there's the outside of the tooth is crystalline, and crystals are made of minerals. So fluoride is a mineral-like substance. It's mineral, and it will incorporate in the place of calcium in the outside of your tooth. It will make a stronger, more brittle crystal. So that's a good thing for a tooth, right? Unfortunately, it will also incorporate into bones. It makes a stronger, more brittle bone. Could that be a problem for a bone? Yeah. It shows in highly fluoridated areas, there's high incidence of hip fractures, especially in women. So that's problem number one for me. Problem number two for me is that fluoride, if you go back to your your high school chemistry class and look on the periodic chart, you'll see where fluoride sits next to all the other elements, and it's right next to iodine. It's called a halide. So it's a similar molecule to iodine. In fact, it's a stronger molecule. So what it will do is it will push iodine out of receptor sites in thyroid hormone, and it will actually bind into that thyroid hormone. Thyroid hormone requires iodine to activate it. Well, if the fluoride binds instead of iodine, what happens is it's not detectable on a blood test that you have low thyroid hormone, because the hormone's there, but it's actually plugged up with fluoride instead of iodine, so it's not usable by your body. So how many people do you know have thyroid issues?
Yeah,
Just
lots.
a few. Just a few. And how many people have fluoride in their system because of water, because of toothpaste, because of mouth rinses, because of supplements that they've been given? So much fluoride in the world. So that's problem number 2 for me with fluoride. Problem number 3 is it's such an unregulated dose. If it's in the water, well, everybody drinks the water. Well, what if I'm already taking a fluoride supplement? What if I already have fluoride in my toothpaste? What if what if I already have a whole bunch of fluoride? Well, now it's an unregulated dose of a drug. The only reason fluoride's put into water is to treat the person. It doesn't treat the water. It's the only thing added to water that doesn't treat the water, because chlorine's added to water, but it's to treat the water, to make the water, no bugs in there. Fluoride, the only thing it's treating is the person, not the water. So my take on it is, why add something that was never in the tooth to begin with? There's no natural fluoride in a tooth. What the tooth is missing when it's weakened is minerals, particularly one called hydroxyapatite. So what we use instead of any fluoride product are hydroxyapatite products. Why put something back that was never there? Let's instead replace the hole that's in your tooth with something that it lost. So we use a hydroxyapatite varnish when you're in the office. We use it for desensitization, and we recommend it for all tooth products that you're going to use. So that's just like the very surface, talking about very, very beginning things, just looking at what does actually something do. So then let's get to your next question, fillings, those sorts of things. Well, first of all, any metal filling that you have in your mouth is 50% mercury. It is today. It's always been. And research, in fact, there was just a brand new research article that came out like 2 days ago that showed that mercury vapors coming off of mercury fillings in your mouth actually exceed the EPA levels in California for mercury toxicity. Just those things coming out of your mouth exceed EPA levels, EPA recommended levels. So this was a brand new article, just barely out. They do release mercury day in and day out, nonstop. Every single time you chew, every single time you heat them up or cool them down. Is mercury a problem? It's the most non-radioactive toxic element on the planet. and yet we're
putting it in our mouth.
Yeah, we're walking around with it thinking that it's no big deal. Oh, they've been there 20 years. It's no big deal. Well, it's now been 20 years of toxicity. So what does mercury do? It's a neurotoxin. So of course, we don't ever do any of those kinds of fillings, but we remove a lot. Unfortunately, when you remove it, it is the time that you get the most in your body, because it's releasing all of the vapors. Right. And not only that, but you're swallowing a bunch of that junk if it's not done safely. So I tell people, leave them in your mouth unless you're going to do it safely, because you're going to get more removing them than you are just leaving them there. So you need to find a doctor. So I will tell you, in fact, I don't know if you can put it in your show notes, whatever it is, there's a website I'll tell it now, but you can also put it in there. It's an abbreviation, IAOMT. And it's big, long words. I won't even tell you the words, but it's .org, IAOMT.org. And it is an organization that talks about the safe mercury removal. You can go on there and there's a dentist finder on that website. So you can find a dentist who's been trained in safe mercury removal, because you need them out, but you need them out safely. So what do we replace the fillings with? We replace it with something called resin, which is a glass plastic mixture. And we're very careful that we don't use BPAs and other things in those materials. And we also replace it with porcelain. So basically glass is what we're replacing those materials with. So nothing metal, nothing metallic. Not only does the mercury, is it a problem, but it actually conducts electricity, which is kind of an interesting concept. So when you put mercury fillings, which have dissimilar metals, there's a few metals in there, along with mercury, a bunch of other things, silver, copper. And when you put that in a weak salt solution, which is your saliva, it will create a battery. Well, that battery drains your batteries. So it pulls electrons out of your system, literally. And this is literally an energy drain on your body 24/7. So the fillings are problematic because of the mercury, but they're also problematic because they're metal, and they're literally draining your batteries 24/7. So we replace them with something completely different. Those are the easy ones. The harder ones are the ones that we start talking about with hidden infections, and breathing problems. Those are the big guys, and those are the huge ones that play a role in hormones. So do you want me to dive into those? Where are we at?
Yeah. So, okay. So I'm taking my own notes here because I'm
Yep.
like, okay, as I have questions about what you've said so far, but I also I know we talked previously about the breathing stuff and hormones, and I want to definitely get there. But first though, I just was thinking, thank you so much for the link to the website for safe mercury removal. I actually had my, amalgam fillings converted over to resin and all that kind of stuff. Now I'm, like when you hear about somebody who has lice and your head starts to itch. So as you were talking just now about swapping fillings, I'm like, my mouth's starting to hurt. Like just hearing you talk about, I'm like, I hope I had everything done well. But anyways, regardless, I was thinking not just about myself and my own dental health, but also my kids. And I was just interested in hearing from you. Obviously, at the very end of this, I'd love for you to direct people to you and your resources and what you have going on. But for people who are looking for a functional dentist for both themselves and their kids, because I know the first thought that crossed my mind was, can I start over with my teeth? Like, can I go back to age 5 and sort of start over? Because I know I have some fillings and I've had, different procedures and things done over the years, had braces forever, all that kind of stuff. But anyways, I was just curious, like, how could someone go about finding a functional dentist for them in their area?
So that IAOMT website is the first place to start.
Okay.
The second website to check out it's another abbreviation. I apologize, but it's IABDM. That one's a little easier to understand. It's like Biologic Dental Medicine, I believe. The International Association of Biologic Dental Medicine, I believe, is what that abbreviation is. It's also .org. So IABDM.org. Now, neither of those databases or dentist finders are going to guarantee exactly what you're going to find, but they are dentists who are open to these concepts, who have been trained at least surface level in them. So I also have documents that I can provide. It's on my website where it says, what should I ask my dentist?
Yes.
What am I looking for? Because those are really the questions that you need to know as a patient. You need to know to say, hey, do you do this? Do you do this?
Yeah.
How do you handle this? And so I've provided those questions for you to ask because they are very, very important to help you screen your provider as well. And, we also do virtual consultations, and I do a lot of those. I mean, probably 10 to 15 a week virtual consults for people all over the world. And we discuss these exact things. And then we help guide you to a practitioner nearer to you. Or you come here. Some people come to Utah as well if they have extensive need, but that is something that I am very committed to helping you find because I'm so, I just believe it's something everybody needs. So not only that, but I also train dentists. I have an academy where we train dentists in these techniques because again, I'm so committed to helping you find what you need. But it's a bit of a challenge. However, what I believe is that more of you start asking, more dentists are going to have to learn.
Yes, absolutely. And I feel the same way about hormone health.
Yep.
And in fact, one of the most valuable resources, as I've been told in my digital course, is that I supply course takers with a list of questions to ask their practitioner. And it literally sounds exactly the same as what you're talking about. It's like, and it essentially is like, when you ask these questions, you're going to know if it's the right practitioner or not, right? Like if you ask these questions and they say, oh, those tests aren't relevant, or they say, oh, you just need birth control, then that's not the right doctor, right? So when you were saying that that's a resource you've created, I'm just nodding my head here, like, yes, this is what people need. So thank you for that. I wanted to make sure that we were able to provide people with like tangible action items on how they can move forward with this. So, okay. So I do want to talk about, I know we talked previously a little bit about like breathing and how dentistry is connected into breathing and just your oral health. And I want to also talk about how this all influences hormones. So I'm just going to open it up to you and let you take it away.
Okay. So there's what I call the big 3 in the mouth that we are looking for when we're looking from a functional standpoint as what could be influencing your overall health. The first one we've already discussed, which is metals, and not only just mercury, there are also a lot of metal containing crowns, there are metal containing retainers, metal containing implants. That's a whole nother bag of worms I could jump into, but I'm not going to, other than just to say that metal does conduct electricity. And so it does change the way your body operates. And those metals are 2 inches away from your brain. So it's going to affect the way your brain operates. So it may be of use to find out how can you replace all metals in your mouth, not just mercury, because the others are going to be stainless steel. They're going to be a gold alloy. They're going to be, titanium. There's a bunch of different metals that go in that are not mercury, but they're still metal. And so they still have the electrical conduction. They still do all of those kinds of things. So that's number 1 biggie. Number 2 biggie is infections, hidden infections. And number 3 is airway and breathing issues. So I'm going to dive into infections first. The 2 places, there's 3 places that are big, but one is talked about a lot. So it's not that earth shattering. That's gum disease. And it's very important. There's actually research shows that about 70% of adults actually have some degree of gum disease. I believe it's largely nutritional driven because your mouth is just an extension. It's just part of your GI tract, your gut. And how many people have gut issues today? So if your gut isn't healthy, your mouth isn't healthy, and vice versa. If your mouth isn't healthy, your gut isn't healthy. So gum disease, this is something you can treat in most dental offices, although they're going to treat it differently than I do. They're going to give you antibiotics, and I will never do that. We treat it with ozone instead, ozone and some other herbal antimicrobials. But gum disease is one you need to make sure you don't have. And that's one that you can do a gum exam, a gum screening, and nearly every dental office in the country is going to be able to do that for you. That's one thing you need to cross off your list, but it's less hidden. Like it's fairly apparent and it's looked for and screened for really readily. The 2 that are hidden that people don't know about are root canals and something called cavitations. So let me talk to you about what both of those things are. First of all, everybody knows what a root canal is, or kind of, they've heard of them. They know they don't want one. But what a root canal is simply if the tooth has had a cavity or a trauma, it's broken into the nerve section of the tooth, then the tooth dies. And, doctors, dentists that were doing dental work were really sick of pulling teeth. Honestly, pulling teeth is hard to do. So they figured out that the nerve section on the inside of the root could be removed, cleaned out, disinfected, and then the root itself could be filled up. I know, it sounds awesome, doesn't it? And then
I'm cringing.
I know. The nerve area itself could be filled in, and then the tooth can stay in the mouth and continue functioning. The idea is phenomenal. To be able to preserve the tooth is awesome. The problem is that we kind of forgot tooth anatomy. So a tooth is a lot like the rest of your body. You have, these big arteries and veins going through your body, and then these tiny little capillaries that take all the nutrients clear out to the ends of our fingers, the ends of our toes, and all these places. The tooth has the same thing. It has that main nerve and blood vessel canal in the center, and then tiny little capillary tubes, basically, that extend off that feed the entire tooth. Well, when we're doing a root canal, what happens is that main nerve and main blood vessel area is cleaned and disinfected, filled up, but it's impossible to clean all those tiny little tubes. And there is literally a mile of these microscopic tubes in every single tooth. So there are so many of them. So what happens is dead tissue, dead nerve and blood vessel tissue remain in those little tiny tubes. And if the tooth's already been infected before you go have the root canal procedure, and bacteria, lots of them remain in those little tiny tubes. It's impossible to clean it. So your body then is required to keep that infection at bay 24/7. 24/7, it's an immune drain. And it's a low chronic, low dose, this isn't going to kill you, but it's going to lead to your body not being able to fight other things that will kill you. So your body's not able to handle things like disease, like infection. We see so many people with autoimmune problems because the immune system now is impaired. It can't deal with other stuff. And now it starts to fight itself because it's confused. It's too busy dealing with these infections in your mouth, and it can't deal with that. We see things like cancer that are directly tied, heart disease that are directly tied, strokes that are directly tied to these failed root canals. They don't hurt because the nerve's gone. That's the worrisome thing. You go, oh, my tooth's fine. I don't feel a thing. Yeah. And then we take a CT scan. So this is the only way to diagnose these is with a dental specific CT scan called a cone beam CT scan. There are many more dentists in the country now that are having these available. Often an oral surgeon will have them, an orthodontist will often have them, and more dentists are as well. With these cone beam CT scans, I can see everything in 3 dimensions. And you cannot believe what I find on a daily basis. I'm finding 80 to 90% of every single root canal that's been performed has infection at the end of the root, around the root, somewhere in the mouth, somewhere in the jawbone, around the root of that tooth. Every single time you chew, it's like stepping on a blister. Every single time you chew, that infection is sent through the entire bloodstream, through the entire body. And now the immune system is on high alert, nonstop, and your body is not well and can't get well. So we have so many referrals from doctors that understand this, that get this, and they say, we will not finish treating you until you get any root canals out of your mouth removed, tooth removed. That's the only way to fix this, because we have to remove the root that has all those tiny little tubules. We've got to get it out of the mouth. It's the only way to fix it. So they will not even continue working with a patient until they do this, because they say, what I'm doing will not work completely. They realize they can get you to a certain point. They can get you 75% better, but you can't get 100% better with these infections still living in your mouth. So we have so many doctors that refer for this reason. This is why I do so many virtual consults, because they're all over the country and they send people from everywhere. And what I do is I have you get a CT scan where you live. It's sent to our office, and then I actually go through that CT scan with you on video and show you what I'm seeing. So we're looking for those root canals, hidden infections. And what do we do if the tooth needs to be removed? We clean it very carefully. We use ozone, which is a broad spectrum antimicrobial. It'll kill any bug that's in there. And then we use something called PRF, which is stem cells and growth factors. And we add it to the site where the tooth was. So it allows the body to regrow and heal. And then we place ceramic dental implants. So we put a tooth replacement in there, and it's all ceramic, no metal, nothing else that goes in that could be conductive or problematic. And that's how we replace the missing teeth. Now, nobody likes to be told they need to lose a tooth. I tell people every single day they need to lose a tooth. And I used to hate it. Like, I used to avoid it like the plague. And I would tell people, I will do anything to save your tooth. And now I say, I will do anything to save your health, even if it means losing a tooth, because I can replace your tooth. I can't replace your health. So teeth are expendable. We can replace them, not your health. So that's the big one. Root canals are huge. The second big one, and I'll finish the infection piece here. The second big one is where a tooth has been removed. There's a ligament surrounding every tooth. And I tell women, get this, it's kind of like the placenta and the baby. It doesn't just come out naturally. So that ligament, if a tooth is removed, the ligament stays in place oftentimes if it's not intentionally removed. And that acts like a sliver in the bone, and the bone doesn't heal properly. So again, this is only visible on a CT scan. I actually have a tool in my CT scan software that I can look at bone density. So I'm going through every single area, and where are most teeth removed? Wisdom teeth. Incredibly common to find these problems where wisdom teeth have been removed. So what we do is we look for bone density. If the bone hasn't healed, I can see it. And if the bone hasn't healed, it means there is soft tissue in the way, and anywhere there is dead soft tissue, there are bugs. So we biopsy these. We've found the craziest things in these places. Bacteria, virus, fungus, parasites living in here, and amoeba swimming around in there. And these are on, I don't know if you're familiar with what are called the meridians. I like to think of them just as the energy wiring of the system. So our body have blood vessels, we have nerves, we have lymph system, but we also have energy, like we have, wires, because our heart is electric, our brain is electric, all these things are electric, and we have to be wired everywhere so that our heart and our brain can run the rest of us. So those wires are connected to your teeth. And the wires that connect to the wisdom teeth also connect to the endocrine system. So I can't tell you how many people that have chronic hormone problems have infection where their wisdom teeth were removed. And I'm finding these 2 and 3 and 4 decades later, still there, still infected, still affecting them, especially on a hormone level. So if you have hormone issues that just don't seem to resolve, even though you're doing all the right stuff and following all your recommendations and doing everything else, you need to go get a CT scan, because very likely you have wisdom teeth that have not healed properly. And I would say in people that are sick, this is probably about an 80% of the time I will find these. So this is huge, and everybody needs to know. And it's every tooth that's been removed. So if you have any other teeth that have been removed as well, this is also a potential. So those are the 2 biggies from an infection standpoint.
Well, this is interesting to me, and this is making my brain spin in circles. But when it comes to this, I just have to sort of reflect outwardly here and just say, it's interesting to me how we always talk about, or I always advocate root cause, right? And this is something that I'm hearing. I listen to like Dr. Hyman's podcast. I listen to a lot of sort of naturopathic podcasts, and the subject of oral health and how it impacts the gut, and how the gut then impacts the endocrine system and all these different connections. Obviously we're a connected body. And this as a side note, one of my personal experiences in the modern medicine world when dealing with my migraine issues was I felt so segmented. I felt like people were only looking at my brain. They're like, your brain is healthy, and no one was taking into account, right, like my endocrine system or the rest of my body. And so all of this to say that everything you're saying to me is just like it seems like every interview that I do, I find someone who goes deeper, right? And so we just released a podcast today, which of course, so it will have been out a while when this one comes out, but we released an episode with Dr. Laura Brown, who is a naturopath out of Canada. And she was talking to us specifically about digestive health and the gut, and how the gut is really the foundation to our body, and how it contributes to our brain health, and it contributes to our hormone health, and all that kind of stuff. But then we just went even deeper and said, okay, well, let's start with the mouth, right? Like, let's start with oral health even before that. So I feel like, just as my own sort of assessment and evaluation of my own brain and my own thoughts right now, I just keep thinking, we just keep going deeper into root cause. Now, here's a personal story. And this doesn't have to be my own little patient appointment. You and I can talk separately, and I can figure this out later. But this is interesting to me because I obviously have dealt with, I would say estrogen dominance tends to be sort of, it's not my root cause, obviously, but that tends to be my trigger for my migraines. And my migraines are the symptom that I experience that is so uncomfortable. Some women, it's, maybe it's heavy periods or irregular cycles, or maybe there's other things going on. For me, it's the headache. The headache manifests itself cyclically. And so in my early 20s, the headache was all the time. It was all the time. We couldn't, and OBGYNs would say, well, it's not hormonal because there's no pattern. And so they wouldn't investigate any further, right? And so it wasn't until I found a functional medicine doctor, and that's a whole other story. You guys who listen to the podcast have heard it. But regardless, I'm now that I'm into this journey, 16 years into this journey of learning about my body, a couple of years ago, the idea was introduced to me. Somebody said to me, well, estrogen dominance isn't your root cause. Like, what's causing that to happen? So I started digging more into like liver methylation and liver detoxification and how I could help that. Right. And then about a year ago, I was introduced to this cellular cleanse. And there's a doctor that I follow on Instagram, and this is so sort of random, but she started talking about the cyclic patterns of parasites, and how specifically about how, and this is very recent for me. So this is all just me like brain vomiting what I'm thinking, but she literally was talking about how, and this just happened for me last week. So we were on vacation last week. My headaches, like I said before, they follow a pattern. I started to pick up on, thanks to my sync scope, I started to pick up on the fact that they were always around a full moon. And so I just thought, okay, well, my symptoms are happening around a full moon because I tend to ovulate around a full moon. So I was thinking, well, that makes sense, because when I'm ovulating, my estrogen surges. And so obviously maybe my estrogen is then higher than my progesterone. And then I go into the headache. It's just estrogen dominance. But of course, this just keeps going deeper and deeper for me. And so I start following this lady on Instagram. And last week she's explaining how the reason parasites come out, so to speak, around a full moon is because of the serotonin and the melatonin and the different changes in the moon. And, you have to hear a message so many times before you're like, okay, clearly this is meant for me. And so long story short, I finally started this cellular cleanse, and I'm interested to see how it goes. I'm nervous because I don't know what's going to happen. I don't know if the headaches are going to come back. I don't know what's going to maybe manifest as I'm cleansing. But now you're making me think further. You're making me think, okay, well, let's think about what happened. And it's interesting because in my early 20s, my headaches really started to sort of, I don't know, fall off a cliff, so to speak, when I was 22. And when I was 20 or 21, I had my wisdom teeth removed.
Yep.
And I had a horrible experience because I had dry sockets in my lower, both of my lowers. You want to talk about pain. There's been two times in my life that I could not endure. I mean, I think I have a pretty high pain tolerance, being a migraine sufferer. But when I had that root canal and I had to, they had to go in and pack those holes, and I was putting frozen peas on my face. I would say that, in addition to my spinal tap that I had in my early 20s when my patch didn't heal in my spine and I had massive headaches from that, those are probably the two most painful experiences I've had. I've had kidney stones. You name it, sister, I've done it. So Regardless, though, I think now you're making me think back to that, and you're making me think back to, well, these headaches started for me at 22. Of course, surface level Jenny, who was just at the beginning of her journey, was like the birth control pill, right? And I'm not saying that the birth control pill did not contribute, because it certainly has contributed to my hormone health. However, you're making me think more about like, okay, what has happened during those years. And when I think back to that wisdom teeth journey, it was an entire summer of hell, like an entire summer. And I'm wondering now, this is obviously something that I'll have to investigate for myself to see, is there something there? Because my doctors asked me before, like, have you ever had a parasite? Have you ever, and there's never really been any sort of, yes, I've been to Mexico, all that kind of stuff, but it's like, you saying that just made me literally like, okay, clearly this is something that I need to investigate. So just sharing that outwardly, because, obviously for everybody, it's a journey, and there might be people listening who this is such a foreign concept, right? That, but to me, having been on this journey for 16 years and starting to pick up on patterns of my body, everything you're saying, it makes total sense. It's like a light bulb is going off for me. And I know someone listening is having that too. So, okay. So I don't want to stop you, but I know you want to talk about breathing. So I'll let you talk about that.
Let me finish that. So what a dry socket is a socket that doesn't have the blood clot form in it, because wherever the clot forms is where bone is going to grow. So you have now identified that I guarantee you have cavitations, because anybody who has a dry socket means that bone did not grow into the socket area. That's what a dry socket is. And it's pretty much 100%. If you had a dry socket, you don't have bone that's grown in that area. So this could very well be your source, your literal root cause source of the parasite that's now throwing off your monthly cycles. The reason also you ovulate on the full moon is also that serotonin effect. It's the hormonal effect that the moon changes. Yeah, I've studied a ton of that myself, because I have some issues in that.
It's fascinating. It's fascinating.
It's fascinating.
Yeah, I always
disgusting at the same time. Yes. I'm like, why am I feeling so terrible? Oh, it's a full moon. Oh, stop. It's like so gross.
It's very real. And when I tell women you're a lunar being, like they're always just like, oh, this makes so much sense. Like, no wonder I hate my husband on this day of the month.
Exactly
right.
Like,
exactly.
It's like everybody gets pregnant all at the same time.
Yes.
Yeah, it's kind of funny
So
how it
true.
works, but it's real. I mean, we live in a very insular society, we live in our air-conditioned homes, and we kind of forget the moon's out there, but he's still doing his job, even though we kind of forgot about him. So yeah.
Yep.
All right. So yeah, the last thing, I'll cover this quickly because there's a ton to cover here, and I can't really do it justice in a couple of minutes, but I at least want to introduce the concept to people a bit. So the third biggie that I talk about is airway and breathing. And everybody says, oh, I don't snore, or I'm not heavy, or, you think all of these myths that are going on. Well, I always ask people are, first of all, can you fall asleep? Can you stay asleep? And people will say, oh gosh, well, I just get up to go to the bathroom. Guess what? There's a hormone that operates in our bodies at night that turns off the urge to go to the bathroom. So if you are deeply sleeping, you will never get up to go to the bathroom at night. So just that alone is a sign that you're not sleeping correctly. You're not sleeping deeply. So if you can't go to sleep, if you can't stay asleep, if you wake up earlier than you would like to wake up and just can't go back to sleep, or if you wake up just boom, wide awake, why can't I go back to sleep? People will say, oh, it's just because my mind's racing. No, your mind's racing because your adrenaline just spiked because you can't breathe. That puts your body in an incredible panic state. And you wake up startled, and now your adrenaline's just, and there's no way you're going back to sleep. Or are you tired in the day? Even if you get enough hours of sleep, are you still tired? These are all signs. The easy one to look at is snoring. Nobody should ever snore, but a lot of people that I see, particularly women, don't snore, but their sleep is terrible. So what could this be from? It's often very tied into those infection and metal pieces. Because if you have infection, think about wisdom teeth. Where are they? They're in the back of the mouth. Well, you have to breathe past a whole bunch of tissue back there. There's soft palate. There's tissue all around the tonsillar area, whether you have tonsils still or they were taken out, there's still tissue around there. That all swells if you have infection in your mouth. So what happens if it swells is that the air can't pass freely. And the body, when gravity hits, you lay down, the tongue falls back. And if you're in true deep sleep, no muscle moves. So this is another sign. If you toss and turn, if your bed looks like a tornado headed in the morning, you were not deeply sleeping. Deep sleep is the place we all need to get to heal. It's what I call construction zone. If you never get to the deep sleep construction zone, you never get better. You're just constantly fighting an uphill battle. So once you're in deep sleep, all the muscles paralyze, including the muscles that hold your airway open. So if your airway is obstructed or closed because of tissues that have swollen from infection, there's also a biggie I'll get to in just a second. But if the airway is too small, once the tongue falls back, once those muscles relax in deep sleep, you stop breathing and your body won't let you stay asleep because you're going to die. So it will wake you up, either lightly wake you up so that you're at least in just, light level sleep. You toss and turn, you roll over, you squeeze your teeth. Squeezing your teeth flattens your tongue out, opens up the airway a little more. You bring your bottom jaw forward, you clench, you do whatever. These are all motions that your body's doing to accommodate for too little room to breathe, because that is life sustaining and you can't live without it. So you must breathe. So your body will do whatever it can in order to breathe. Now we're at a little bit of a disadvantage nowadays, because have you ever wondered, why do people need their wisdom teeth out? Like, how weird is that? 200 years ago, was everybody getting wisdom teeth out? No, of course not. They didn't know how to do that. They fit in their mouths 200 years ago. So what's changed with our mouths? Well, it's developmental, but it's mostly environmental. The things we eat have completely changed. The things we feed babies, we feed them all these soft things that don't require any tongue movement, that don't require any jaw development, that don't do anything, and jaws don't develop. We also aren't nursing for 2 years like we used to be 200 years ago. And I am never in the method of, making mom guilt happen, because I adopted 2 children. They didn't get nursed at all, but there are things we can do to accommodate, because a bottle completely forms the mouth in a different way. A pacifier completely forms the mouth in a different way. A sippy cup completely forms the mouth in a different way. And what we now have are mouths that are too small. They're too small to fit the stuff that needs to fit. So the tongue, the tissue, everything is in a much smaller space, and instead just goes back into the throat. This is enormous for children. If a child is bedwetting, if a child has ADHD symptoms, if a child is grinding their teeth at all of those are signs that your child is not getting enough air. So bedwetting is an enormous one, that they're not getting enough air. And that is a sign that you need to do some what we call interceptive work, or we intercept that growth and development and direct it while the child is still growing. Because how many people do you know have had crooked teeth? I mean, the orthodontic industry is huge. 2 of my brothers are orthodontists. They've made a lot of money off of crooked teeth. Why? Why are everybody's teeth crooked? Because they don't fit anymore, because our mouths are too small. They don't fit anymore. Nothing fits anymore. And we are literally a generation of people who can't breathe. So we have all of these chronic downstream symptoms, even headaches. This is hugely related to headaches too. We have all these chronic downstream symptoms that we are addressing and trying to treat without realizing that a huge piece of this is probably because we just simply don't sleep and we don't breathe. So there are all sorts of things we can do. It's not a CPAP. Everybody's like, I will never wear a CPAP. Great, because I'm never gonna prescribe one. No, I want to actually fix the root cause again. I want to make your mouth big enough for everything that needs to fit inside. I want to get infection out so nothing's swollen, getting in the way. And we actually have expansion appliances, expansion devices for everybody from 2 years to 92 years. Everybody can expand their jaw, can expand their mouth, and make room again to breathe. And I probably talk about this with 7 out of 10 patients every single day. This is an enormous one.
Yeah. I mean, I feel like we could have a whole
hour on this,
on breathing. So yeah. And you know what, I just wrote down a little note for myself. I'm like, you're going to be in my Rolodex. Like, we're going to be coming back to you at some point to talk more, because we haven't even scratched the surface of hormones or scratched the surface of breathing and all this kind of stuff. And we're already running short on time.
Yep.
I know, but I have a 5-year-old and a 1-year-old, and they both have their own unique, like my 5-year-old took a pacifier when she was young, and we've noticed that she definitely has some issues with sleep. There's no bedwetting. She's been really, ever since she was potty trained, she's been pretty good with that, but she always seems to have night wakings. And now that she's 5.5, she has started to voice, like, she'll tell us things like, well, I woke up because I couldn't breathe. Like, she'll say things, or she'll say, Mommy, I was breathing like this, and she'll pant. And I'm like, wait, something's up. So my question for you, this is just a personal, like, for my own personal benefit. But, our primary care doctor, our functional medicine doctor had said, we can set her up with it was sort of out of the realm of her knowledge. So she said, we could set her up with like a sleep specialist or a sleep study and all that kind of stuff. You instead would be more able to help us with just expanding the mouth and kind of, again, root cause. So this makes total sense. And then my 1-year-old, I just answered my own question, so sorry. But my 1-year-old, when she was born with a severe lip and tongue tie. And this is something that I'm going to have my own episode on this someday, because this experience in itself deserves a story out in the world that people can hear, because both of my girls are adopted as well. And unfortunately, we never had an experience in the hospital or anywhere else. Nobody ever set us up with a lactation consultant. So this, I obviously wasn't breastfeeding. And so with my 5-year-old, she took the bottle. I remember, she took the bottle immediately, drained it, had never had any issues. Like, she was just so easy with the bottle. My 1-year-old was not. It was horrible. Every time she would go to feed, she would scream, she couldn't latch. And of course she was miserable because she couldn't eat. And of course she was considered failing to thrive when she was first born. She was under that 10 percentile. And we were literally just like, what is going on? So we took her to, at the time, we were still seeing a pediatrician. We no longer see a pediatrician, but we were seeing this pediatrician, and the pediatrician, I think, had seen her 2 or 3 times, had never once looked in her mouth. And I just kept saying, like, my mom gut was like all my lights were going off, and I'm thinking something's wrong. Like, this child is struggling to eat. I don't know what to do. And of course the pediatrician's like, well, she'll outgrow it. It'll all get better. And I'm thinking, I can't live like personally, like, I don't mean to be selfish, but I can't live with this. Like, I can't live with having we had to feed her in a shower with the water running.
Oh, wow.
With the fan going, like, with noise and all that, just to get her to calm down. And long story short, I'll keep this short, but we were exposed to chiropractic care, and the chiropractor was a pediatric chiropractor. And she said, within seconds of us walking in the office, she said, this child has a severe lip and tongue tie and she needs it corrected. And I was like, I couldn't believe that we had seen a pediatrician 3 times. And I won't spend this episode on that whole story, because it's obviously infuriating to me. But regardless, she directed us to a lactation consultant, who then directed us she ended up having a laser procedure that was about 10 seconds long that took care of it. And within 30 minutes, she was latching onto the bottle, and she's now 85 percentile. As an 18-month-old baby, loves food, loves to chew, never was into soft foods at all. So she's thriving at this point. But regardless, that in itself has been such a powerful thing for us to learn about, because when we then took, I remember around the time that she was born and we were dealing with all that, we did myofascial release therapy. We did ongoing chiropractic care, because we didn't want it to grow back. We didn't want to have any long-term issues. And I'm so glad we did, because I tell my husband, I'm like, she hates the car seat. So every ride, 2 or 3 times a week to go to these appointments was not fun, but it's about her long-term health, right? It's worth it in the end. And so I have so many friends who we then started to meet people who were like, oh, my child had this, or my child had this. And so many people opt, whether it's their doctor's advice or not, to not correct it, or they do correct it, but they don't go that extra step of doing the myofascial release and doing the chiropractic. So anyways, we could have our own episode on this.
It'd be a whole episode on this one alone. But,
yes. But, and that taught me, like, I remember looking at my 5-year-old's mouth, and she has this really big gap between her front teeth, top teeth. And I thought, oh my gosh, she's got a lip tie. And I didn't, of course, never, because she ate well, I never thought about it until my 1-year-old was dealing with it. So now that's something that we are addressing and we're looking into now for the structure of her mouth, because now she's losing her top teeth. And so we need to get this figured out. But anyways, all that to say that I'm starting to see, not only from my own hormone health and my own health issues, and just in talking to you, and also through my daughters, how important it is to pay attention to the mouth, and how really functional and essential it is. Okay. So I know we're out of time, so I'm going to have you back. But I want to make sure that we wrap up. I have one question I want to make sure we address briefly, and that is hygiene. So for anybody listening, what are your top tips on hygiene, and including products that you might recommend for people?
So hydroxyapatite containing tooth powder or toothpaste. No fluoride necessary, something with hydroxyapatite. So there's a few brands. Actually, I'm creating my own tooth powder right now. It should be out hopefully within the month, but with another big, if anyone's heard of Just Ingredients, she and I are collaborating together on this tooth powder, which will be phenomenal. But at the moment, I recommend Risewell is a great brand, or Carex. Carex Kids is a good one for kids as well. So those are good products that have hydroxyapatite. Always a soft bristle toothbrush. I actually love, there's an electric toothbrush called Burst that I quite enjoy. It's very soft. The kids love it. I love an electric toothbrush because, especially for kids, they don't have to do the work because they're not going to. So they might as well put something in there that doesn't work for them, So I love electric toothbrush. I don't care if you floss or not. You just got to clean them. So my favorite product is actually called a shower flosser. It just installs right in your shower. You switch a little bit of the water over from your shower to the shower flosser. It doesn't make any mess. And you just clean up all the gum areas while you're doing it. Mouth rinses. Cool. I just like a very simple saltwater rinse or even baking soda rinse. You don't have to do anything fancy. You can add some nano silver to that rinse for if you want an antimicrobial action, but that's it. You don't need to get all of those fancy mouth rinses. They actually have a high level of alcohol. They dry your mouth out. They kill your gut bugs. You don't want to do any of those things. So don't use them. There's no reason to use them. There's no reason to spend money on those. They're not necessary. And the big one, another one that people forget about is cleaning their tongue. So you need to use a tongue scraper because that's where often candida will live. So fungal infections, if you have chronic ones you can't get rid of, you got to start scraping your tongue. I guarantee you that is where it's living live and well right now, and you need to get it off of there. So those are my quick hygiene tips for making sure your mouth stays healthy. If you do those things, you're not going to have problems.
That's amazing. Awesome. I'm going to find those products for everybody and link them up in the show notes so that everybody has quick and easy access. And if you would send me a link to your product, and that way when it comes out, we can put that there as well and advocate that. Okay. So if you're listening to this and your teeth and mouth aren't tingling like mine, and you're not thinking about all this stuff now, surely you are now. So my first thought here is, and I have this thought so often when I'm interviewing guests who are in the functional health space, why isn't this the norm? Right? I find myself asking that when it comes to hormone health, like, why aren't certain tests the norm? Like, why are we telling women that they're crazy, right? Or that they're normal? And the same thing goes for this and for oral health. So what you're doing in the world and taking your own story, I love meeting people who've taken their own struggle and turned it into their message. And I love that this is sort of your purpose and your passion, and that you're out doing this because it's certainly making a difference. I know there's going to be a lot of people listening to this who think about dentistry in a whole new way, and who take an initiative to maybe make a change. So before we wrap it up, please tell people where they can find you, whether it's social media or your website or any resources you might have. I'll let you direct people and then we'll wrap it up.
So my dental office is called Total Care Dental. So you can always find me at totalcaredental.com and on Instagram, Facebook, anywhere. There's so much information that I've provided online. So go check it out because there's free stuff everywhere. I believe Instagram, Facebook is Total Care Dental Utah. So check it out, Total Care Dental Utah. On Instagram, we're always putting things on there. The website has all sorts of resources. It also has that virtual consultation link that I talked about, where you can request a virtual consultation and I can guide you from afar and help you find a practitioner as well. The other outreach I have is called Living Well with Dr. Michelle. So this is where I've now taken a lot of these things regarding diet and nutrition and turned it into a lifestyle. So if you're interested in healthy living, gardening, self-sufficiency, medicinal gardening, all those kinds of things, check out Living Well with Dr. Michelle. That's the website, that's the Instagram, that's Facebook, that's everywhere as well. I do want to throw one more thing talking about kiddos. The thing to look up for that is called MyoBrace. So that's what you need to look for your daughter, your 5-year-old, MyoBrace or Healthy Start. Those are the two products that you're going to want to look for that will help direct the growth of the mouth. And on those, there are also practitioner finders. So MyoBrace or Healthy Start, or you can just Google, someone that does MyoBrace near me. And if you find somebody that does that, they're going to know how to help your daughter. So those are good resources.
Excellent.
So lots of places to find help. You just need to know where they are.
That's amazing. Well, we just covered so much good stuff in less than an hour, but yet I feel like still, I know that when we had chatted, we talked about this using food as medicine and growing things in your windowsill. And we didn't even get to that today. So we're going to have to schedule a part 2 with Dr. Michelle in the near future so that we can talk more, not just about oral health, but just holistic living and the other sort of realm of knowledge that she has. So, but for today, I thank you, my friend, for coming on here. You
Thank you.
are honestly just a powerhouse in the world, and you're making such a difference for people. This is obviously what you're meant to do. You're a natural teacher, and I've loved learning from you in the last hour, and I'm craving more. So thank you so much for being here, and I know we'll be talking again soon.
Thank you for the opportunity.